Oh. Good afternoon. I'm Councillor Alan McCrow, and I'm Chairman of the Pharmaceutical Needs Assessment Subcommittee. The other members of the subcommittee who are present today are Mike Bridges, Consultant in Public Health, April Purpedy, Acting Service Director, Communities and Wellbeing, and Zoe, I've forgotten her name, Campbell. Gordon Oliver is the clerk for the meeting. The meeting is not being live streamed, but be recorded in the cloud. So it'll be on YouTube, so members of the public can later follow up proceedings. Please can I ask everybody in the meeting, make sure they switch on the microphone when invited to speak directly into them, and then to switch them off when they're finished speaking. No test of the fire alarm is planned, so if we hear the fire alarm, we must leave the building immediately via the emergency exit. The assembly point is the Dolphin car park. If the lockdown alarm sounds, we will remain seated and await instructions from officers. We will adjourn the meeting until such time as it's safe to proceed. Do members have any questions about the way we conduct the meeting before we proceed? Thank you. Do we have any apologies, please?
Yes, Chairman, we've got apologies from Professor John Ashton, and Mike Bridges is present as his substitute.
Thank you. Do we have any declarations of interest related to items on the agenda, please? No, thank you. We move on then to item 3, the unforeseen benefits application, Kingsland Centre in Thatcham. Could I ask Mike Bridges to present the report, please?
Thank you, Chair. So item 3, application offering unforeseen benefits, Kingsland Centre, Thatcham. An application has been submitted by LPSD 107 Limited for a new pharmacy at Kingsland Centre in Thatcham Town Centre. As a statutory consultee, the Health and Wellbeing Board have been invited to make representation by the deadline of the 10th of February. However, there's no board meeting scheduled before this date, which is why the application is coming to this subcommittee for consideration. Despite the closure of Lloyd's Pharmacy in Kingsland Centre in 22 and then the immediate closure of the Boots Pharmacy at Thatcham Health Centre, no gap in provision is judged to have occurred, which is why this is considered in the application offering unforeseen benefits. In order to be approved, the pharmacy must offer significant benefits. The relevant factors are whether there is a reasonable choice of pharmacies in the area, how easy it is for people to travel to the existing pharmacies, ease of access by different modes of transport, whether the proposal would address difficulties experienced by particular demographics in using local pharmacies, and whether the proposal would have a negative impact on the existing pharmacies. It is perceived that the new pharmacy would offer a range of enhanced and advanced pharmaceutical services, improve capacity and choice for patients in Thatcham, improve the resilience of the local pharmacy sector, be open on Sundays, which would save residents having to travel to Newbury, be in a central location that's accessible by a range of transport modes, offer free home delivery service. It is not considered that there would be a negative impact on other pharmacies, and should be noted that the applicant operates one of the 2 other pharmacies in Thatcham. A draft response has been prepared expressing support for the application as set out in Appendix B.
Thank you. Are there any comments from other members, please?
Just to say, I think it is supportive. We've had quite a lot of pharmacies obviously close over time. We've had many discussion at Health and Wellbeing Board about pharmacies closing. So yeah, supportive.
Yeah. Times lack of education. So
just one thought I had while Mike was making this presentation, demographics. close to, on the other side of the Kingsland Centre, there's a new development for retired people. And there's also I think there's 2 other sheltered housing or similar places in the close vicinity as well. I was wondering if we could put that in. Yeah.
Just another point to also mention that this would be the only pharmacy in the town centre of Thatcham, which would be more accessible.
There is the can't remember the name of that. It was Lloyd's and it's now been taken over by somebody else, just off the A4. So it's fairly close, isn't it, to the centre?
At Crown Mead.
Crown Mead, that's it. Yes.
It's just out. It's fairly close. It's fairly close.
And yeah, I think you're probably right, actually. So, any other comments or questions? Could I have a proposal then, please? No. And seconder, please. Okay, thanks. Those in favour? Thank you. We then move on to item 4, another application offering unforeseen benefits in Newbury Town Centre. Could I ask Mike to introduce this item, please?
Thank you, Chair. So this report provides details of representations made in relation to an application offering unforeseen benefits for a new pharmacy in Newbury Town Centre by CA Health Limited, and invites members of the Pharmaceutical Needs Assessment Subcommittee to consider whether they wish to submit any further comments in response to the matters raised in the other parties' representations. It is recommended that the Pharmaceutical Needs Assessment Subcommittee agrees that a chairman should write to the Pharmacy Care Support England to make comments on points raised in the other parties' representations made in response to the unforeseen benefits application by CA Health Limited, set out in paragraph 4.7 of this report.
Thank you. Does anybody want to make any comments or questions, please?
Would you like me to go through the comments in 4.7? Yep. So 4.7, of the remaining points raised in the other representations, most are considered to be valid, but it's proposed that the board may wish to comment on some of the issues raised by Day Lewis Pharmacy representation as follows. Where there is no active hyperlink to the median broadcast within the application, the supplied web address was correct. The next point, the representation indicates that new developments referred to in the application are not in the town centre, where the applicant proposes to open its pharmacy. While the new developments listed are mostly dispersed around the fringes of the town, they will be served by public transport, walking and cycling networks that will link to the town centre. There are other developments within the town centre, such as the Market Street development, that are not mentioned in the application, but which would be in close proximity to the proposed site. Next point, existing pharmacies are not spread evenly throughout the town. 3 of the pharmacies, Boots, Tesco's and Wash Common Pharmacy, are on the town's southern fringe at the top of the large hill and are not within easy walking distance for much of the town's population. Next point, while Newbury may be an affluent town with high levels of car ownership and a mobile and healthy population, there remains pockets of deprivation and households that do not have access to a car, including those on low incomes and elderly disabled residents. Services should be designed to meet the needs of all users, not just those that have access to a car, and should be designed to help address these inequalities. It's proposed that the Health and Wellbeing Board, Pharmaceutical Health Needs Assessment Committee should make comments on the points raised any other representations made in response to the unforeseen benefits application by CA Health Limited as per paragraph 4.7 of this report.
Thank you. Any other committee members wish to comment?
Just in relation to the comments made, I think again, we're supportive in terms of having another pharmacy. We've seen lots of pharmacy closures, and we've had lots of conversations and within the board with our members being upset about closures of pharmacy and the effects that it may have on our local population and our residents' ability to access some of those services. So we would probably see this as a positive, that there's going to be another pharmacy within the Newbury area to help serve our residents. And again, if people can walk there rather than have to get into the car to travel, that's got to be a benefit.
Thank you. There's one point that I think is a bit misleading in Day Lewis's response on the item V. It says the applicant states, if boots are not able to fulfill a prescription within a timely manner, the patients have no choice but to travel to Newbury Retail Park. This is simply not true. As discussed earlier, our pharmacy is a short walk away, and there are several other pharmacies less than 2 miles away. I think that last phrase is not correct.
Chairman, I believe that the other pharmacies would be just about within 2 miles of the Boots pharmacy on the southern fringe of the town. But as we said earlier, it is a very steep hill to get there. We do have the one at the retail park, the one at Tesco's and also the one at Wash Common.
I'm sorry, I forgot about the one at Tesco's. Could I have a proposal then, please? Zoe, thank you very much. Seconder? April, thank you very much. Those in favour, please show. Thank you. That's unanimous. Okay, thank you. So I would like to thank everybody for attending today. Is Sarah still on the screen? Thank you, Sarah, for attending. And so I'll therefore close the meeting.